Hello, thank you for joining us. This is day 2 of Research America's National Health Research Forum, and I'm Mary Woolley, the President and CEO of Research America. We are so fortunate to be kicking off this day with a conversation in our Science on the Front Lines series. We're going to be talking with Congresswoman Diana DeGette of Colorado and Congressman Fred Upton of Michigan. As it happens, they both represent the first district of their respective states. It's really kismet. But in truth, they don't only represent their district, they represent each and every one of us. They work tirelessly with a combination of determination, of vision, and accomplishment to meet the goals of this nation. We have been privileged to work with them for some time now and know just how committed and how successful they have been. Now, I also want to introduce with pride the moderator for today, Frank Sesno, the Emmy Award-winning journalist who now is at George Washington University, where he heads strategic initiatives at the School of Media and Public Affairs. So without further ado, except to say thank you again, it's over to you, Frank.
Well, thanks, Mary. It's delightful to be here. I really look forward to this conversation. I can't imagine anything more relevant and important at this time. And Congresswoman DeGette and Congressman Upton, you've told me to be on a first name basis with you, so henceforth we will do that. I just want the audience to know that in no way is it anything other than a pleasure. Is it not disrespectful at all, but a real conversation. So I look forward to this. Knowing that COVID-19 is what this conversation ultimately will revolve around, I still want to start with something related and relevant and a landmark. It was an accomplishment that predated any discussion of COVID-19 before it happened, and that's the 21st Century Cures Act that was done in 2016. Both of you and your staffs overcame huge challenges to deal with this and to get it passed. You're recognized by patients and researchers alike, partly as a result of this, as champions committed to addressing the misalignment between the importance and the value of faster medical progress and the priorities around it, as well as safety for patients and the integrity of research and science. Now, the 21st Century Cures Act is credited not only with accelerating these sort of moonshots like the BRAIN Initiative, but also doing a reset of discovery, development, and delivery, the pipeline, to move at what we like to call the speed of the possible. Let me start first with each of you, and what you feel is particularly important in terms of the outcome of the 21st Century Cures.
Well, when Fred and I started working on 21st Century Cures, we really wanted our research and our approval systems in this country to keep up with the exciting scientific discoveries that we were having and the ways that we could deliver research. And so when we started working on 21st Century Cures, we really worked with everybody. We worked with the stakeholders, we worked with patient groups and pharmaceutical companies and the agencies themselves to figure out what the barriers were towards research and investigation and then approval of drugs and devices by the FDA. And so we set ourselves a very big vision. And in the end, we felt like, as well as the money, which was so important for things like the BRAIN Initiative, the Cancer Moonshot, all of that, but just what I call the guts of the bill, 350 pages of restructuring at the NIH and the FDA to expedite the way we do biomedical research and then approval in this country. That was what we set out to do. And we were really proud of the way it turned out, because we hear every day about advances that have happened because of the barriers that were broken by 21st Century Cures.
And just before going on to Fred Upton, the biggest hurdle in getting this thing passed back in 2016 was what?
Well, I would say it's difficult to pass any legislation right now in Washington, D.C. And I think the biggest hurdle was just inertia, frankly. And Fred and I frequently talk about how we just basically physically dragged this thing over the finish line. I mean, we had a tiny little window in the lame duck session after the 2016 election. It was the last major bill that President Obama signed. The other thing, as you kind of alluded to, it's really difficult right now in this atmosphere to do anything in a bipartisan way. But Fred and I really formed a great partnership, and we've worked on a lot of other issues because of that.
So Fred Upton, I mean, that's one of the reasons I asked that question is being in Washington, it is so difficult to do anything. And this is a very big deal that crossed the aisle. So the same question to you as I asked earlier, and what do you feel is the big outcome from the 21st Century Cures Act?
Well, a couple of things, and I agree with exact. Thanks for the question. It's great to be with you and so many people on board as well. I'll tell you what really began to drive us on this. And first of all, Diana and I have been very close. I've been to her district. As it turns out, my son literally lives across the street from where her mom grew up. I mean, it's amazing in Denver, and I was there a couple of weeks ago. But she's been to my district here in Kalamazoo, where I am now. But what started us on this process was just the frustration, being on the Energy and Commerce Committee and for me on the Health Subcommittee, you just see so many tragic stories of all the different disease groups, the patients, the lack of real progress on finding cures. Sometimes, 70 years people have been taking the same medication without any real breakthrough. I mean, last night watching NBC, give them a little plug, they had a wonderful series on where we are on a new ALS drug that's going to freeze the symptoms of ALS. This is what we wanted. The real cure for sickle cell, bingo. I mean, it 60 Minutes highlighted this. And what we were seeing over the last good number of years was research in America it declined. The venture capitalists started to invest overseas by 50% loss in terms of investment here. So what did we have to do to change that and still maintain the safety standards, the FDA gold standard that we wanted? And so we sat down, I guess if you put the hours together, it would be weeks with people like Francis Collins and the FDA and others. And we simply asked the question, look, tell us what we can do legislative to really move this process forward so we can find these cures. And the bill itself, it grew and grew. One of the things we were most proud about was the money for additional research. And that, in addition, for health research, $45 billion over 10 years. And with it, we're seeing those breakthroughs. So then fast forward to today, the pandemic that we're all in. Of course, we all want a vaccine. We all want the testing. In large part, when that happens, it will be, I'm not kidding, it will be probably a year or two faster than it otherwise would have been. And yet we're still not going to cut the corners that some may think may happen. And that was very important. But we also asked questions. We asked the FDA. We said, all right, then it was the Commissioner, Margaret Hamburg. We said, Margaret, we're going to demand you to do more. What do you need? And she said, well, we need more money. We said, well, how much? And when she saw that we were serious, she said, she shot high, $500 million. Fine, but we wrote it into the bill. We did what we said we'd do. We sat down with Joe Biden, and we knew it was, the cancer moonshot. And, whose fan? My cousin just died of cancer last week.
Sorry to hear that.
What is it that we can do to find these cures for all these diseases? And the cancer moonshot, the brain initiative, all these things. And when you ask what the biggest hurdle was, it was time. I mean, we took on some entrenched folks, some that wanted to take credit for it, change in administration. Maybe we'll try to get this through next year. No, we've done all this stuff, but we had the support of our leadership on both sides, from Nancy Pelosi to John Boehner, obviously Mitch McConnell, Lamar Alexander did a great job, and the White House.
Well, I want to put an exclamation point on what we've just heard from both of you in the environment we're in, because to hear that there's bipartisanship around research, that there's bipartisanship around cures, is very important and encouraging and inspiring. It's also vital as we head into a time of vaccine for COVID, when that happens, that people can have the confidence and the faith that there's support for this. So let me move us into that context, because I understand you put together sort of a preliminary package, sort of a 21st century, cures 2.0. It's my understanding there are proposals directed at a COVID-19 response, as well as reforms aimed at sort of speeding medical progress, addressing some short-circuiting between development delivery phases of this pipeline that I mentioned earlier. You've also introduced the RISE Act, which is meant to build momentum around $26 billion in the next emergency relief package to restore COVID research funding. So there's a lot going on here, critical efforts here. Could I ask each of you to lay out, and Diana, why don't you start, your priorities when it comes to the threat of COVID-19 and this imperative of really fast-paced but safe research for both medical and public health purposes?
Well, the issue around COVID-19 really has crystallized the need for biomedical research. And just to back up a little bit, when Fred and I started putting together Cures 2.0, what we were trying to do is find some things that had not been fleshed out enough in the original bill. And what we realized when we started working on this, and again, doing a big collaborative effort with different groups and voices, we found that there were a number of issues that directly related to COVID-19. And some of it was improving pandemic surveillance and testing capabilities, supporting microbial resistance product commercialization, expanding vaccine development and surveillance, a number of issues like that. And so what we did, as well as put them in our position paper that we released, we also put them in this additional piece of legislation, which we have been urging our leadership on both sides of the aisle to include in the next legislation that we might consider in Congress.
Right, Upton?
Well, let's face it, just the change that Congress is working right now, I mean, with in essence a shutdown, the lack of hearings, we vote now by alphabet. I vote with the Z's, being an Upton. Diana votes with the A, B, and C's.
That's the biggest division we've ever had between the two of us, is that voting gap.
Yeah, our offices are on the same.
I think maybe you want to pursue the bipartisan Alphabet Reconstruction Act or something like that.
Yeah, exactly. So, but I'll tell you some of the things that we're seeing. So, as an example, with COVID, and we know that the real disparity with racial, folks impacted by race and who's dying in a number of cases. We need more diversity in trials. We're hoping to get that in there. Yes, we want more research, and I'm hoping that'll come. But we now, because of, Congress, in essence, we had to leave. I mean, we're doing a lot of these Zoom calls. We're not there in person. You have many fewer legislative days than ever before, and those relationships, they don't sour. They just don't happen. And you don't have the same legislative calendar. So as we now are in, the last month before the end of the fiscal year, no one wants a shutdown. What is it going to take? I'm actively working on yet another COVID package, helping our states and communities, a whole number of different things. I'm in a bipartisan group called the Problem Solvers Caucus. But we're hoping, my sense is, and Diana's on the majority side, leadership side on that, I'm hoping that, whatever happens this month will contain some funding elements and others that continue the progress that we've made. And knowing that we haven't really been able to have the legislative hearings, the markups, building the relationships to get a big bill through, which thus gets punted probably into early next year versus what we can do immediately that nobody has any problems with, and try to get attached to that last train leaving the station.
You don't have a sense that a specific sense, you can't, as to what the timing might be on 21st Century Cures 2.0?
Well, the majority of it, in all likelihood, happens next year. And we've got hundreds and hundreds of comments. But we're going to need the hearings. You know, Diana's chair of the oversight subcommittee.
Diana, what do you think about timing?
Yeah, so when we started working on the concept paper of Cures 2.0, it was before the pandemic. And Fred's exactly right. It's slowed everything down in terms of the interactions. But nonetheless, we did release our concept paper. I think we had 500 comments, and our staffs have been working on incorporating what makes sense. And then we expect later this year that we'll release a discussion draft of a bill. But Fred and I both agreed a long time ago, the idea of passing Cures 2.0 this Congress is just unrealistic. We only have, I think, 3 weeks left of voting before the election. But that doesn't mean that we can't take the COVID-related provisions that we're both talking about and include them in some kind of omnibus legislation that might pass.
Given this timeline that you just mentioned, with respect to both 21st Century Cures 2.0 and the RISE Act and that $26 billion that you're looking at, what can advocates do to contribute to this momentum, to kind of, you know, help you with the work that you're doing? I mean, the people who are listening, watching now are by definition believers in all of this, and I'm sure everybody wants to help. How?
Fred?
Well, weigh in with your, I mean, we need this. First of all, you know, when Cures passed, 21st Century Cures passed, we passed it 392 to 26. Diana and I know who the 26 are. And we also, when it passed 92 to 8 in the Senate, we know who the 8 are. And, you know, part of it was we really had a coalition nationwide of people weighing in, not only to co-sponsor. I mean, this was a bill in our committee, you know, I chaired it, always tradition of bipartisanship, 53 to nothing. The two of us worked very hard to make sure that that happened, knowing that that was the driver then to get the Senate, which didn't have the opportunity to have the hearings. I mean, we were lucky that we had someone like Lamar Alexander and other leaders in the Senate and the White House to say, look, this passed overwhelmingly in the House. You got to take it now. You can't let this work go by the wayside. So all the different patient groups and others helping to weigh in, making sure that we had the votes to pass it by the margin that we did, allowed us then to get it done literally on almost the last day of President Obama's presidency. A huge signing ceremony for all the right reasons, and we were off to the races. Diana's right. A big bulk of this is going to happen in the next Congress, but we're hoping to get elements of funding for this, and for the NIH and the FDA and others into this package that we have to do before the crystallizes really this month, before the end of the fiscal year, September 30th.
All right, well, let me ask you a question about that. And Diana, I'll start with you on this one. Since you're leaders in Congress and I still walk around with the journalist gene, I look for a little news here. So are we going to see an emergency spending bill? Will it include funding for COVID-19, this eroded research that we were talking about?
Well, so Frank, as a former journalist, you'll appreciate I was just talking to one of my Colorado journalists who asked me the very same question yesterday.
We're not very original.
And I reminded him that the House has already passed an emergency bill in May. And so what we're waiting for now is for the Senate and for the White House to actually negotiate some kind of an agreement. And so that's what we're waiting for right now. And I think Fred's a better person to ask this question to. When do we think that the Senate and the White House actually might come to? Everybody knows we need to do something. And by the way, Fred totally agrees with this too. This is not a totally partisan issue.
Well, I think we're actually getting closer. I'm in another group called the Problem Solvers Caucus, 50 members. I'm one of the vice chairs, equally divided Republicans and Democrats. A couple members on our committee, in fact, remember this. We meet regularly, Zoom calls probably 2 or 3 times a week now. We've had a couple conference calls. We're actually trying to find a sweet spot between where McConnell was in his package that he unveiled in July that was weak, and the HEROES Act, which passed in the House back in May. We think we're pretty close. We're hoping to unveil formally where our group is, and pretty much all of us would be on board. We got just a few little glitches, and I missed the conference call yesterday, but I'll get an update later on today. But we're hoping to provide an impetus then for the leadership, particularly in the Senate, both sides, working with the White House, getting a bill the president can sign that will include elements of the funding that we need to get this done and get off the dime. Our schools are now open in Michigan. Our communities, whether they be counties, cities, states, real loss of revenue. You got issues like liability relief, enormous things that are tied to this pandemic that need to be addressed, and it would be wrong for us not to address them, which is why we're trying, as the Problem Solvers Caucus, to get people into that room, maybe enough beer and pizza to actually strike the deal and come back and get a deal that, certainly the House can support on a bipartisan basis, the Senate and the president too.
And that deal that you're talking about embraces the $26 billion that would address that sort of COVID-19 eroded research that had to take.
Starts the process that we can then have that as part of the deal.
So do you see that 26 billion being the number? Is that the number?
There's dials here that you play with. How long is this going to be? And if you have a shorter time frame, you don't need as much money, and you can get within that spending cap deal. So it's doable. Let me put it that way. It's doable.
So Fred's saying he doesn't really know. But let me just can I just say
it's coming.
In terms of biomedical research, though, that is something that people ask me a lot about, aside from this $26 billion. And people say, are we going to be able to fund research? And Fred and I will both tell you, there is a strong bipartisan commitment to funding biomedical research in the NIH. And we did pass through the House on July 31st, our appropriations bill on labor HHS. And this included $47 billion for the NIH, which is an increase of $5.5 billion over the 2020 enacted level, $8 billion for the CDC, which is $232 million above the last year's level, and then $343 million for AHRQ. So
that's the Agency for Research and Quality, just so
exactly, and so I think that those, we might quibble over some of the other provisions of the labor HHS appropriations bill, but I think you would find strong bipartisan bicameral support for those research dollars. Don't you, Fred?
Yeah, I do. And so, Frank, and you know how this will play out. When this, at the end of the day, how this works is we're going to have a COVID package. We need it. Everyone said, this will be the fourth one. It will be attached to what we call the CR, or the continuing resolution.
Right.
The Senate hasn't passed any of these appropriation bills. The House has passed most of them. So it'll be one gigantic package, which will include the funding that Diana just outlined. And again, bipartisan support. You look at both sides of the aisle for the NIH, real leaders, stalwart leaders, House and Senate for this. I'm convinced we're going to get that done.
And you're going to get that done with those numbers that Diana just mentioned?
I think we'll be pretty close to that.
I think we will.
But it'll be, so we'll be able to get, the liability and the stimulus checks and fix the unemployment, all those things that would be in a normal COVID package that we've done, PPP, paycheck protection. That'll be one element combined then with a continuing resolution that then funds all those different appropriation bills and get it done before the end of this month, because that's when the fiscal year expires, September 30th.
Okay, so for those of us who are destined to live in Washington, we know the continuing resolution means that if you don't get it, the government shuts down. We've had that too. Is there a chance of a government shutdown?
I don't think anybody wants to see a government shutdown just days before an election. I think we'll do a continuing resolution. I think the issue is how broad is it? As Fred says, is it just the appropriations bills or other things like a relief package? And how long does it last? Does it last through the lame duck session into the next Congress? But I don't believe there's a chance of a government shutdown at the end of September.
Fred, you agree with that?
I sure hope not. There's a couple little rumblings I heard earlier this week, but I believe that it'll be a combined package. And, for me, I'd like to see it happen through March versus, let's bring us back November 15th. No, we'll be in the same spot. Let's just do it right and get these appropriation levels right. How in the world do you run an agency if you know that you're only under a 6-week stopgap? And remember, before we had a 35-day shutdown, which was terribly disruptive to every agency that was impacted. So let's not go there.
To close our conversation, I'd like to ask you to connect the policy we're talking about in the research to the people and to the real world that you represent and the people you know, right? We've got a $3 trillion bailout package, COVID package that recently passed. Our national debt is soaring, our deficit is soaring, and there are limits, and there are some people who are saying there need to be more limits on what we spend. And yet, everybody is affected by COVID-19. Everybody wants to see the very best and the very fastest and the very most credible way thrown at that, along with these other things. These dollars you're talking about here, I would think are supported broadly on all sides by your constituents. Could you just talk, each of you, about what do you hear from your constituents? I think people who are watching this conversation, who are in the research community, who are in the science community, would be really interested to hear, how does this play with the public? How does this play with your constituents? Fred, you want to go first?
Yeah, disease doesn't strike just Republicans, it strikes all of us. We all have really good friends, that struggle and suffer with just awful illnesses. And I'll tell you, one of the best things that one can talk about is the progress that we're making. I mean, the news on ALS. I mean, when we did this, we had roundtables. We brought in some kids with cystic fibrosis. You take diabetes, all these diseases, and we have made such progress. I mean, we've tapped some brilliant minds, Michael Milken and others, different research institutions. I mean, the industry, the patient groups tell us what we can do, and we've seen the progress. In the 3 years since, 3.5 years now since President Obama signed the bill, we have seen real progress. That's what we need to continue, and that's why Diana and I are absolutely committed to working on this to really save the day for families that otherwise will lose someone and face that pain forever.
Diana, we would want to sing from the mountaintops from that, but we live in a very polarized time. Is that your take as well?
Yeah, I mean, when I talk to people, it's interesting because people out here in the mountaintops in Colorado and all around the country, what they see just gridlock in Washington, and what they see is their families struggling not just with COVID, but with disease, as Fred is saying. Every family is impacted by some disease. And when I talk to them about the bipartisan, bicameral work that has been done on expediting cures, but in a safe and effective way, everybody can agree with that. And I can get up at the most progressive group in Denver or the Chamber of Commerce and give the same speech about 21st century cures. And people are so grateful because they understand that this will impact their family. And frankly, I think that's why it's been so gratifying for the two of us to work on these issues, because we really are working on issues that impact Americans in their daily lives. And we're seeing now how we can take the advances that we've made and apply them in the COVID era. And so we hope that we'll be able to do more of that so that we can get treatments, cures, and prevention much more quickly to all of America.
Okay, before we go, I said that was the last question, but I lied. I want to ask you both a question I ask so many people who are on the front lines of COVID-19 and polarization in these times, and that is, how do you keep yourself centered? How do you, with so much strife and so much suffering around us, what's one thing each of you does that you might suggest that the rest of us try to kind of keep centered through all of this? Diana, you want to go first?
Sure. Well, I think that it's so easy for members of Congress and people on the front lines, healthcare workers and others, to just be in that space all the time. I think you have to take yourself out of that space to keep your sanity. So
Or what do you do?
So I do yoga, I do Pilates, I hike a lot. I just spent half a day last week riding horses through the most gorgeous mountainous country you ever saw, and it cleared my mind.
Sure. Okay, Fred Upton, how are you going to do one better on that?
Well, you know what? I do a lot of things, but I like sports a lot. I got my Wolverines and my Cubs, and for a good number of months, I could watch every Cub game at night, and they won every time. I mean, Sammy, he had 6 home runs in 2 days. And people that don't know baseball, he retired a lot of years ago, so they're running all these highlights. So they won every game, and I'm in such a better mood when my teams win, and whether it was in the, it's the 1995 game or, whatever it is. Now they're still winning, which is good. Now the season has started, and maybe there'll be some Big Ten football. We'll see, but you got to just take a little time out. And, for me, I got a great spouse, Amy, and my parents are 96 and 91, and they live across the street, and they live on Lake Michigan. So I'll go for a quick dip or something like that, ride my bike. But you got to take it. We're actually, I would say this, we're actually all working much harder doing Zoom. The travel is much harder getting back to DC because of the airlines aren't running as often. Our staff, they're all in their individual apartments or condos, as you're seeing Diana there and me here. I mean, it is so much harder to operate and to work and connect with your constituents who truly are needy. We just had a call on an unemployment issue here. Someone it's run out and they're desperate. And the utility company is, they haven't paid their bill in weeks and weeks. And, it's a really hard time for lots of folks, which is why this pandemic legislation, the next COVID package, is so important that we do it right and we work together to get it done.
Well, here to that. And Fred Upton and Diana DeGette, both of you, thank you for the work that you do on behalf of your constituents and on behalf of the country. Certainly thank you for the work you do on behalf of research and science and advancing medicine and faster cures. So we all of us here appreciate your time and participating in this conversation. So thank you to you both. I'd like to go back over to Research America now and Ellie Dahoney, who will have some closing remarks.
I just want to take the opportunity to thank you so much, Congresswoman and Congressman, and also your staff members, Sherry Lee Santos and Mark Ratner. Just a terrific team you have, both of you. And for the audience, if you could just, and I'm sorry, Frank, forgive me. Thank you for the wonderful job. This is just such a great conversation. And for our audience, if you could stick with us for a couple minutes, we'll have the next segment soon. Thank you so much.